I'm doing better. Jody can come.
Okay, at 6:30, let's start the meeting of Sawyer County Health and Human Services Board meeting for October. Call to order. Excuse us. People?
Carol?
Wow. The meeting's on?
Yeah.
Yes.
In here.
Sorry, guys.
Sorry. Haven't seen you for a while. Roll call. Dale Schleter,
Here.
Reed Schumann,
Here.
Dale Olson.
Here.
Chuck Van Etten. Ron Pettit.
Here.
Noreen Goudet.
Here.
Jennifer Bobornik. Sarah Pearson. Here. Sabrina Dunlap. Here. You have a quorum.
Thank you. Certification of compliance with open meeting laws.
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Meeting agenda, any questions, changes, concerns? Okay, we'll move right along. Public comments. Anybody from the public? We're going to have some. We'll go right to committee reports. LCO liaison.
Or number 6. Carol.
Minutes. Yeah. Approval of minutes.
In my defense, I had a visit to the optometrist today. I have a huge cataract. Sometimes that's why I've been missing. So over here, my left eye and the right eye just isn't. Good news is I'll get it taken care of and everything should be back to normal. There it is. Okay, motion to approve last month's minutes.
I'll make a motion to approve.
I'll second.
September 7th as presented.
Thank you. We had a second by Deanna Pearson. All in favor, say aye.
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 So now we go to committee reports. LCO liaison. You have anything?
I'll start with,
Yep.
I wanted to start with our LCO Health Center update for COVID-19 response. The LCO Health Center currently has 30 positive COVID-19 cases. 7 positive cases were tested today. We are seeing infection with younger patients with the Delta variant. The LCO Health Center has COVID-19 vaccines available, including Pfizer booster vaccines. LCO patients are required to call the health center clinic to schedule a COVID-19 vaccine or booster dose. You must be 6 months past your second dose of vaccine prior to getting the booster dose. You also must be an LCO tribal member, family member, employee of the tribe, or a current LCO patient. The LCO Health Center has mandated vaccinations for all LCO Health Center employees. However, we are allowing religious and health exemptions. LCO Health Center employees are 97% vaccinated. Any health center employees approved for an exemption will be required to wear an N95 mask and will be tested for COVID-19 twice per week. LCO Health Center is holding outreach vaccinations for COVID-19 Pfizer booster vaccines and seasonal influenza at the Reserve Elder Center on October 14th, at the Newpost Elder Center October 21st, and at the Signer Community Center on October 28th. All vaccinations are scheduled for 1 to 3 p.m. I wanted to add to that report that the mandated vaccination, the tribes are now taking that next step. What we're seeing for people, the positive cases and how many are getting sick and how many are being infected with this disease and how many people are losing. So we started with our clinic. They're the health providers. They're the ones that are working directly with our people, and we need them healthy and safe to continue that care. So we wanted to put that there, and then we're gonna be working on step by step. So we're gonna be addressing things little by little. And the school followed our mandate with the mask and using all the safety precautions to protect the children. So we keep our doors open for school, and they continue to do so. And we know we're going to see cases, positive cases at times, where we are trying to keep them as safe as we can, and we are trying to vaccinate our people as quickly as we can. We still have, for a while, I think everybody was getting to feel a little comfortable because we were not seeing as many cases. It was getting to be normal, but it's not. So we are taking that stand now to do what we need to do. That we will continue to do that. And so we encourage people to get vaccinated and to get their booster shot when that time frame goes by. And we are seeing that those that are vaccinated that do become positive are able to fight that stronger than those who haven't. We just buried a young man the other day who was healthy, strong, had no health condition, no morbid condition at all, and came in contact with the disease but was not vaccinated, and we ended up burying him a month later. So these things are, and then we're seeing more of our younger people. So we take this seriously. And but I wanted to just touch on that. And then the other thing that I wanted to touch on is we are continuing to try to we're working on plans to help meet the needs that we're seeing with the opioid drug epidemic in the community. So we're trying to keep building on what we've been working on. We've always run into some hardships along the way, but we're still pursuing it. So we have our men's shelter, women's shelter, our domestic abuse shelter. This is still operating, and we're building and making it more to where we can house more. And then our treatment, we have more of our people who need that care with reduced contracts to have that available for them. And we're trying to work on the transitional housing now. We're still trying to do that piece, and you got to be careful how you do things. There are funding sources that come through. You got to watch all those stipulations, what we can and cannot do. So we're trying to work on that. We're trying to keep educating. I know that that's an important piece too. Keep educating, keep informing, and so we're trying to do everything we can to help our people. And right now in our community, we are experiencing multiple deaths in our community right now at this time, and we had 4 more over the weekend. Various reasons too. They're not all COVID. They're all different reasons behind it. But our people are grieving, so we're trying to give them support and trying to help the people from that loss. And do what we can while they're going through that healing process. So, but that hits our people hard because it hits the whole community. So we're experiencing that, and we're trying to do what we can. The totally was unexpected. So with all the different programs that we're working on, we're trying to build. The college is doing their piece too. They're doing what they can to keep our students safe and keep educating. And we just had a big summit at our college to try to let our students and our community know what we have to offer. And we're trying to build on that. And that ties into some of the AODA needs we have too in mental health. We're trying to expand our programming, so we're hoping that we can educate more of our people from our community so we have what we need here. So while we're expanding those programs, keep that in mind what we need so we can tap into that when our students are pursuing that education, so we can have them work for us with either tribe or the county, wherever they're needed. So, but I think that pretty much want to add anything to me.
Just if you want to expand on incentivizing the vaccine for some of our people.
Yeah,
Did you mention that?
And no, I didn't mention that piece because I wasn't sure yet where we're at.
Yeah.
We got to watch what we have because how you have those incentives, you can't use everything you have for one purpose, and you will not have what you need things get worse and worse. We need to be careful what we do. So if we're gonna do that to help people motivated or more given that incentive to get vaccinated, we're looking at ways to have that done at the same time. What we're experiencing, we need to have everything in place to respond to the pandemic. So it's kind of, we're not sure yet which way we're gonna go, but we're talking about that. I know the state has made those initiatives nationally, they've done things, but within the tribe, we're working on it.
Are you experiencing that, Julia, where they're starting to give payments to people that get vaccines now?
They did it for about a month through the state.
Okay.
We didn't have a huge uptake for that. Most people that came in were surprised that they could get their, I can't remember what they were getting.
$100.
Yeah,
So.
and that's what we were looking at for tribal members, like get the booster, or get the vaccine started.
Mhm.
Yeah.
So we-
And I don't know if they haven't talked about whether they're gonna start that up again or not.
Thank you. Ms. Pettit, did you wish to speak now?
Yes, thank you, Chairman. Ms. Gouget, my first question. Has the tribal mask mandate been rescinded? I've asked this for several months.
Mhm. We kind of have, remember how I said people think that we're back to normal again and that things are going okay and things, you know?
Well,
They're-
it's
they're-
yes or no. Did the tribal governing board rescind the mask mandate?
Actually, it just expired, Don.
Yeah, and then we're in the process of implementing it again.
Right. We're on the, similar to Sawyer County, we're highly recommending that people wear a mask.
But now we're heading towards
Yep.
mandating it again.
So my next question would be is that you're going to mandate the vaccine for the health clinic employees, but then individuals don't TEP check or not, or they're not masking?
That's been brought up. Certain entities are mandated, but not the whole tribe yet. But we're leading
The health
towards
center's
that.
mandated masking though.
But the health center, yeah.
Yeah.
The health providers, yes. But you're right, Don. Trust me, if it's up to just me, you know the story.
Because we're following at the college, which there's
Yep.
been some question about it from the clinic, that we have had in place the infrared temp check from Go. We have all the safety precautions in place. We do all the sanitation, sanitizing everything there. And we also are pre-screening people. We're masked up. So that's where I'm trying to juggle here, that I've asked it for several months. And if we're under a mask, if the reservation was underneath a masking mandate, I didn't understand why it was not being followed through.
Yep.
Because the Delta variant, with the spread of it and what's going on within the tribal community at the moment.
Yep.
Okay, any other questions for Ms. Boucher?
You could mention our quarantine homes and how they're been
Oh, yeah.
rolling.
Our quarantine homes that we have right now, our people are full because of all the things that we're seeing. We're trying to get them as quickly as we can, or get them to a healthier setting, because those are some are more at risk, or they have in the family and have the positive themselves. So we're trying to address things quickly as we can. And sometimes I don't think we have enough. But I did hear you, Don.
Anything else? Okay, Senior Resource Center. Joey, are you here?
I'm here.
Okay,
Can
you're
you
up.
hear me?
Yes.
Okay, good. All right. I'll give a quick recap of the meal count, because we have a couple things, the regular report and then our 8521 grant resolution. We're still averaging about 152 meals per week, per month at all of our senior centers, anywhere from 72 to 20 meals. Costs are repeatedly going up every week. the last month or so, I've been doing all the ordering for 3 to 6. And on the average for all of our sites, our costs for our meals are going up about $100 a week for our food. We just did the cost analysis for the state. We just finished that. And right now it is costing $10.69 per meal that we're making at all of our sites. So starting on November 1st, anyone under the age of 60 will be required to pay the $10.69. But the $5 donation for 60 and over will stay in place at this time. The state average for meals right now is around $13.13. We're a little bit below that, but this cost analysis was only done for 6 months, not for a whole year due to COVID. So in 2022, there'll be another one that will look at, 12 months and part of 2021. But right now, it's costing on the average $10.69 to produce a meal. That not only includes the food cost, but also includes staff time, administration, everything else that goes into providing those meals. So that's where we're at with that right now is with, $10.69 a month. And like I said, food costs are going up. It's getting harder and harder every week to get the product that we need for the meals. For example, today I had to reorder several things for different sites because you can get the lids, but you can't get the bottoms. And one week you can get the bottoms and you can't get the lids. For example, we couldn't get canned sauerkraut, so we had to go to the 2-pound tubs. So it's different with everything. Your beef, pork, and chicken are going up continually. So we do have a 6-week cycle of fall and winter and a spring and summer menu. Probably at some point we'll have to relook at those fall and winter menus and change the meals a little bit based upon the costs that we're seeing that are rising with all the products that we have to buy for the meal. So I venture to say that $10.69 could go up before the end of the year. But that's where we're at with our meal costs right now. But like I said, our meals are averaging, Hayward's average is 72 meals a day. Stone Lake is 38, and that includes breakfast and lunch. Winter is averaging 22 meals per day. Excellent is 20. And those averages include both home delivered, carry out, and congregate meals for all of the sites. Does anyone have any questions about the meal sites?
Yeah, Joy, I have one question.
Sure.
Approximately how many people come in who are over 65 for meals? I mean, what?
Not very many. Not very many. I think in the last 6 months, we've maybe had 3 people that came in twice with family members. That's typically what we see is people coming in with a family member because they're here visiting their parents and then they would come into lunch with them. But it's not something that we see a lot of.
Okay, I was just curious. Thank you.
Yep.
Is
You're
that
welcome.
because of COVID?
I think that has a lot to do. I think that has a lot to do with it because we're not getting a lot of people coming in for our congregate meals because a lot of people are still worried about, COVID. We do the household at tables. We do the 6 feet apart. We do all of our, COVID things that we put into our plan and stuff like that. People still aren't comfortable going out. So the numbers aren't there. Our numbers are still high with home delivered and with the carryout meals.
Okay, you want to go over the grant resolution?
Sure. It's that time of year again when we do the resolution for the 8521 grant, which provides the funding for our senior resource center bus that provides rides for people to the center, grocery shopping, doctor's appointments, going to classes, different things like that. The amount of the grant again this year, this is the same as last year, $79,889, with the county match being $15,978. So the grant this year is exactly the same as it was in 2020. There was no increases.
We,
I'll make a motion to approve the DOT grant application as presented.
Yeah. Okay, we have a motion and a second. Did you get the names? Okay, discussion.
Since we haven't done our budget yet, I'm assuming we're going to have the $16,000 allocated. We'd be foolish not to, so let's make certain we do.
Yes, that is correct. That is incorporated within the budget.
Okay, any further questions? Everybody in favor, say aye.
Aye.
Anybody opposed?
I,
Got your grant.
Thank you.
Thank you.
You're welcome.
Administration.
Nothing on administration.
Okay, any,
I'll mention a couple things.
yeah,
Just a couple items that we've been working on. One, we've talked about a little bit in the full county board, the opioid settlement that might be concluding here with some of the big pharmaceuticals. We have a tentative settlement, and by we, I'm meaning the nation, and the different states are participating. In Wisconsin, counties are participating as well. So the counties, if this goes through and the settlement goes through and we agree to it, the county would be seeing some settlement dollars directly through this settlement. So the stage that we're at now, the Wisconsin Attorney General has signed off on participating in the settlement. He'll be sending out information to the counties, which would provide a form for us to participate. And so that would be brought before the full county board. We don't know the dollar amounts yet that are allocated across the nation and the counties, but hopefully within that packet we'll get shortly here, we'll have some settlement dollars, know what they are, and the timing. You know, this is a settlement that would be paid over several years. There's a couple different facets to it. I think one's over 9 years and one's over 5 years or something like that. But we'll get those numbers before we sign off on the agreement. But that is moving through the courts, and we should see something maybe even next month at the full county board. The other topic on the mental health front, you know, the out-of-county placements and some of those costs that are really driving our budget out of control. We did have some conversation with Senator Petrowski the last time we met for our CAP team. He's interested in hearing a proposal. So we've met with Kyle Christensen and Sarah Dietrich from WCA. They're the lobbyists and the people that help with the health and human service items, and several other county administrators and HHS fiscal staff to kind of come up with the ideas that would be put in a draft form of legislation that somebody like Petrowski could bring forward then to help us with some of those costs. Some of the ideas that we kind of kicked around, and some of the, I think the one that kind of floated to the top, you know, we talked about, you know, increasing the levy limits, which is going to hit opposition. So that's not going to work. You know, looking at the last 3 years of expenses and saying, if you don't go over this amount, maybe the state kicks in. But, you know, our problem is the last 3 years have been, you know, we can't afford what happened the last 3 years. So to say that that's acceptable really doesn't work. So perhaps something like a case-by-case basis, if this person costs over this dollar amount, then the state kicks in after that. So kind of a stop loss kind of insurance idea. So those are some of the things that we're trying to kick around to get some draft legislation in front of some people and get that moving along. The timing on that, of course, nothing would probably happen until the next budget, which is 2 years away. But the way the legislator works, it takes a couple of years to get those things wound through the process. So at least we've got some ears listening now. You know, we had to knock on their doors several times, but they're interested in it. They're looking for, you know, legislative priorities for the next year. So this is, you know, on the top of the list here so far. So we'll just keep you abreast on that, and we'll talk a little bit about that again when we get to the budget, because, you know, those have budget ramifications as well. So that's my update there.
I got a question for Tom, Mr. Chairman. Tom, is the senator still thinking about building more facilities and centralizing them? But I don't see where that would cut the cost, though. That was his proposal, remember
Yeah.
at first?
Yeah, that idea is still out there. Does that help? I don't know.
Yeah.
It's certainly Sawyer County would be interested in hosting one of those, but
No.
where would one be located and what kind of cost would they have?
It would be nice, though, to cap it so we knew what to budget for. And anything over and above that. Or have all the counties pitch in on whatever the cost is there. Because it seemed like some smaller counties get hit. 2 or 3 people in our county just, bust our budget wide open.
Yeah, and it was nice that we talked with some of the northern counties in this group meeting because they're the ones that have the issues. The larger counties that have great big budgets, they get 1 or 2 people. It's a blip on the radar. We have a small budget, 1 or 2 people causes us.
Right. And this form to participate in that opioid disbursement, is there going to be data needed that we can submit to make us more attractive?
No, it's all, there's a formula that'll be developed based on population opioid deaths in the county. So it's all information that they've gathered to present in the lawsuit to get this settlement. So the data portion has already been completed and, the total dollars have been agreed upon. So then it's just a matter of allocating that out based on a formula that they'll come up with.
Population based.
Well, that's part of it, population, and there's some other factors
Yeah.
too.
And there's the severity index is in there, I'm sure, and we're like number 4 in opioid deaths, and we're right up in the
Yeah,
top of
okay.
the county, so the data should be there.
How far back did they go with it?
I did not know.
I didn't know that. I didn't read that, right?
The tribes are in this too, right?
Okay. That takes care of adult long-term care,
That was administration.
administration. Do you have anything to add for adult long-term care? That's
I've got, Laura Perlick gave a report, just some highlights off of that. If you've all read that, just things to, they are still down 2 positions. There's a halftime ADRC information and referral specialist that is vacant, as well as the halftime adult protective services worker. The ADRC of the North was recently awarded, so that's the consortium of all the counties, $200,000 for dementia care specialist program. And what they're looking at to make it more attractive to try to hire somebody is a half-time position in Sawyer County to be incorporated with a half-time vacant INA position so that we can advertise a full-time position. They're hoping maybe that would be a little more attractive, but we were awarded that money. The elderly benefit specialist and the disability benefit specialist are busily preparing for the Medicare annual enrollment periods, which is October 15th through December 7th. So we get a big influx at that point in time. And kudos to Carol Martin. She was recently recognized by the Wisconsin Department of Health Services Bureau of Aging and Disability Resources for what she put together. And you actually have handouts for the website that was created. And you actually have handouts for that.
great.
And that's the next thing that's on there is that handouts.
So that takes care of adult long-term care.
Yes.
Okay. You have anything to add for behavioral health?
You have a report from Alicia
Right.
on that. One thing I do want to point out is under CST program, the Coordinated Services Team. You can see that we lost our CST coordinator again. So one thing that we've done within the department, we, as the rest of the nation, are having a hard time recruiting people. So we've tried to brainstorm and come up with the best alternatives we can. So within the clerical unit, we have offered, there's 2 different units that we are supporting more. There are 2 clerical positions, one which we will be doing half-time clerical and half-time CST service coordinator. And then we also have a half-time clerical that is now helping and being a public health assistant to Julia's unit. Again, we're having a very hard time recruiting staff overall, and this was a win-win situation for clerical unit staff that are interested in progressing with the agency and going to school to get degrees in these areas anyway, and to try to fill and try to get some of the direct work done to the clients as well as the support staff units. With that, we did have some changes. We went down, we had 2 desks open for the agency when people came in, and now we're down to 1, so people have to wait in line a bit longer. But with COVID, we did see a reduction to people coming into the agency. And when we pitched this idea to the administrative team, I said, if things go back to what an old normal, then we'll have to relook at things at that point in time. But for now, this is, we are about 2 or 3 weeks into this endeavor, and it seems to be going well so far. One thing too with the behavioral health, which isn't in Alicia's report, but I thought was important to share with the board for kudos. A barrier to services for Sawyer County residents is the fact that licensed marriage and family therapists are not allowed to give a diagnosis on functional screens. So for the CCS position program and the CLTS, or any programs that need functional screens, that takes a whole lot of professionals out of the arena that we can get into. And actually that really limits us being able to get people onto programs, especially the CCS program. Alicia alerted the state, and the reason, and let me just go back one moment. They can provide diagnosis for any other program, and they can do prior authorizations, for anything else except for functional screens. Alicia made the state aware of this and questioned it, and she received a response back saying, "Good job speaking up. Your voice has improved Wisconsin." So, and that has helped us out tremendously to get our programs forward, because we were down to 1 therapist on CCS. And if we took her out of the mix of being able to sign off on the diagnosis for functional screens, we were at a standstill. So good job, Alicia.
So now the
Wow.
state allows those people to do that.
Yes,
Yeah,
and
okay, that's
they took
very
her
good.
idea and they implemented it immediately. So anyway, I thought you needed to know that.
Thank you.
On the
Mr.
mental
Chairman,
health,
oh, sorry.
I'm sorry, go ahead.
Patty, is the CCS program still budget neutral?
It never really was budget neutral.
But we
had to
expected
get in
it to
there.
be because it's a billable service, right?
When, in the first few years it was supposed to be, but after a point in time, I budgeted at 80%. And the reason is because we have more time into it than we can possibly get back. That's non-billable. It's called direct support time, because of not having the therapists there and having to wait so long to get people in. That a lot of times we put in all of the front work, and then we get down to the final time of signing them up, and they don't want to change therapists. All that time is not billable to anything. So when I did the budget, I budgeted at 80% in 2022, the same, which I did for 2021 also. Because we had 2 therapists, now we're actually down to 1. We had one fall off that was going to be seeing someone, so seeing people. So that's the problem that we're running into now, is that, we'll go through all the work, spend all the hours, and there's a lot of them to get somebody to the final, and then when they come in to sign, they decide that they don't want to see, they don't want to change therapists, or the problem is that, some of the therapists, we could probably get them virtual, but they want to see them in person. They want a therapist that they can see in person. So we're really limited on being able to get therapists onto the CCS program with us.
So do they know we don't have enough therapists and they really don't have a choice? Yeah, okay. You were going to say something about the.
Oh, just that the mental health cost by client report is also in your packet.
Okay,
Flesh had a comment, Chairman. Chairman? Oh. One of the staff had a
Alicia?
comment.
Alicia, okay.
We're just gonna tell you all, the next thing that I'm taking on is changing chapter 36 so that the mental health providers don't have to be CCS certified. That way we wouldn't have this issue. So as long as they now know my name, and I had a moment, and I
And
figured
you're from
I-
Sawyer County.
And I'm from Sawyer County.
Amen.
Yep. We're well known, not always for good, but this time so I'm thinking as long as I'm on a roll and we've got this dialogue going about all of the barriers that we're facing up here, I figured, why not? So our regional rep is helping me with it down there in Rhinelander, and I keep sending her things, so she'll ask me a lot of questions. I will answer, and who knows, it's worth a shot. I didn't think this would happen, and it did. So if we can get 36 changed, all the better. And that, because the substance abuse professionals, they don't have to be CCS certified, so they can go to any substance abuse counselor. So why would it be different for a mental health clinician? I don't understand the rationale. So we'll see if we can get that changed too.
Go for it.
Yeah.
Behavioral health.
That's it for behavioral health.
That's what we just did, okay. Child Protective Services.
Child Protective Services, the unit is very short-staffed and struggling. They are down 2 youth justice positions and a Child Protective Services worker, and they also have another worker on family leave. So they are struggling to keep up at this point in time.
Is that?
Chairman?
Oh, yeah, go ahead. Yeah.
This question is Patty. Seeing they're down caseworkers and physicians and so forth, how does that work out with their clientele with the timeframes that are mandated and so forth? I mean, if you've got half the staff working, the caseload didn't change. So what is the balance? How are they doing it?
They are prioritizing and doing what is absolutely mandated only. So maybe they don't get out to see the children in the group homes and RCCs as often as they're supposed to. Maybe they aren't meeting all of the guidelines, but they know that the children are safe there. I mean, in theory, they are prioritizing and putting out fires, doing what they can when they can, but they haven't gotten any applications.
So is the
on that
agency
either.
at risk because we're so short-staffed you're saying that all the mandates are being met, even though we only have half a staff, but the caseloads are large.
What I'm saying is that they are prioritizing the mandates. That's really what I'm saying. I mean, all the mandates being met? No, because you're supposed to offer all services every so often,
Right.
and there's no way to do all that. So all I really know about all I really know what to say is that Carla tells us that she is prioritizing and that they are, that the state is well aware of our situation and that they are in communication with the state to let them know. But, you know, their number one priority is referrals and keeping children safe.
Of course, yes. So that means more out of home placement probably then too.
Yes,
Yeah.
yes. And reunification, not as readily available because they do not have, because when you don't have the time to work with a family,
Right.
you're going to place, I mean, and I'm saying something that Carla told us at a management meeting. So I'm not speaking out of turn
And
on
safety
that.
comes first, I understand.
Right, so so out-of-home placement costs are going up and there are more out-of-home placement costs because they don't have a choice.
Right.
Yeah, I was looking at that too, Patty. So that's something that's hard for us to budget for as well, correct?
Correct.
Yeah.
Does Senator Petrowski know about this problem as well, Tom? With residential care
Yeah,
facilities for
the,
children and
Yeah, we talked about that in the group too. So, yeah, I mean, there's a lot of different facets. And then we talk about, you know, there's so many different things. And then we get kind of bogged down in, you know, which ones are going to get taken care of. And I mean, if you get too convoluted about the whole thing, it goes nowhere. So it's got to be
Right.
simple enough that something's going to come through.
Thank you.
Patty, did you cover the substitute care report?
Yeah, just that it's within there for
Yeah,
your
okay.
review.
Okay. Economic support?
Economic support, they are doing well. You have a report there from Shauna and it's showing that their numbers are excellent. And they are doing well.
Questions, Carm? Now we're on public health.
Okay. We've got everything up on the screens for you. So we are still at a high risk level right now. This graph is starting back from about June 2020 and moving through. Interestingly enough, I did not think that we were going to hit that high as much as we did towards the end here. So this is definitely with Delta is spreading more so than what I thought the impact would be. Typically you see about 2 months time of spread before it kind of works its way through. So we're getting there. By the end of this month, hopefully we will start seeing the drop. We have seen a little bit of the dip here, but we're really pretty stable at around 63. So the other thing, I understand some questions had come up by cases, by age group. We have to be careful about how we distribute the information so that it's not breaking HIPAA. And so one of the things that we can see from January 2020 through October 11th, this is the only way I can separate this particular data. And what I did here was just pull the difference between Sawyer County, which is the first blue line, the Northwest region, and then the state, just so that you can see comparison of how we are with the state and the regions. As our demographics point out, we have a lower amount of 18 to 24-year-olds that actually live in Sawyer County and a higher amount of 55 to 65 plus that live in Sawyer County by percentages. So it kind of works its way through. one of the things with the 65 and up, those cases we really saw at the very beginning time of the pandemic, and they are starting to wane down because of the vaccination status. And then this is a data set that is shared of all of Wisconsin. And by looking at those numbers, you can see that we compare fairly close to Wisconsin in what we're seeing with the data. And right now, it's the unvaccinated people that are really getting COVID. And so you can see it's really the 18 and under are the ages we've seen. One thing that we have definitely seen with Delta that we didn't see before is really getting those young kids too, because we've seen the school or the child cares needing to close down. The other thing that's happened with them is they also got hit pretty hard with RSV at the same time as COVID. So it's been really difficult on the daycares, but I think everybody's up and running again, I'm pretty sure. So that's
Julia, what about
that's
the
good.
mortality? I mean, what are you finding with the Delta versus the first strain of COVID?
Where we were seeing the deaths before was in the 65 and older mainly. And with them being vaccinated, that is looking much better. And so as we kind of go through, I don't have a full death rate, but I do have a compare group so that we can kind of just see that for Wisconsin. Yep, you want to go back to that
on the
one?
previous slide, because you said this shows something about vaccinations. And this doesn't have anything to do with vaccination, does it? This is just cases.
This is just cases, but the cases, when you look at where we're at with the people that can get vaccinated, it's definitely lower amounts of cases. And we're seeing it more going into the 0 to 18-year-olds, just there's no vaccine there. So they're bumping up, no matter who you bump up against, they haven't had antibodies developed.
But everybody, from what your chart is showing there, July 11th through our current date, we took a spike there. Shouldn't that curve remain flat if this vaccine is working?
It's not going to be 100%, and we don't have everybody vaccinated. I can show you the different, I'll show you some other slides that just show you the difference between the number of people who get COVID who have been vaccinated versus unvaccinated. I have a better slide to show that. And so that will probably help a little bit. And then as we kind of go through here, you can just see where we're starting to see some of the shift with the 18 and under are starting to kind of pick up again. And again, this is it's mainly once Delta got in, that we're seeing that spread in that younger age that we weren't seeing before. The other thing that we probably are also seeing is that they're getting tested more frequently than they were before as well. This then, I've gotten asked a few questions about the other variants and what we're seeing, and we can see that really Delta is the main thing that is happening for Wisconsin and continues to be. Just going over the data on community transmission that we have been showing over time, and just kind of reiterating that we are high. The hospital capacity, we brought this up in the past too. In the Northwest region, we're kind of in the yellow. It changes from day to day. The most significant thing that I have been hearing is that it's a little bit more difficult, or has been, to transfer cases. Okay, thank you.
It's that overshoots. I mean, you cannot, we call 18 hospitals, sometimes 20 hospitals. We are getting that's for people. So it's a significant problem.
Yeah,
the hospitals are way busier
than normal. Yeah. So this is a day-to-day, hour-to-hour that changes on the hospital capacity. So it's a hard one to kind of look at. I kind of go more by what I hear from the hospital, and most recently it's not necessarily because of COVID overtaking the hospital. It's the cases, and it can be heart attacks, strokes, different things that we need to get transferred out that we can't get transferred out.
So how much of a percentage do you think there is with COVID?
in our hospital.
Yep.
There's a couple that sort of constantly.
They're
full.
constantly
Yeah.
being used.
But everyone else are sick people that, like some of which would have gone to different hospitals before, but can't now.
So
All right,
They're needing to keep people.
We're keeping six.
because the
Sicker people.
ICUs are full.
Yeah,
Yeah.
exactly.
Got it.
Exactly.
Yep.
It's like backing upstream.
So
Yeah.
on 10/6/21, there's 106 people in the hospital.
This is from the Northwestern region, and that is, they were 106 people that were diagnosed, that were being treated for COVID in the hospitals in the Northwest region. That has, it's not necessarily our hospital, you know, we don't have 106 beds, but that's the only way I can get the data sent to me is from that region.
And that's 12 counties.
I will show you the picture. It is right there. Thank you for counting. Never counted.
So the ones that are full, are they like Rice Lake, Duluth, and the ones that people go to when they need to?
They're pretty much, I can tell you that, like surrounding us, you can't get anybody to Duluth right now. Eau Claire is full. We've sent people to Madison and across, you know, when necessary. But even like we do lateral transfers to Ashland, they've been full. So small community hospitals as well as the big ones are. Mayo, cities, all of them.
Because you hear all kinds of data, all kinds of information, and some of the other states are seeking out hospitals
I know.
They're
for their
looking all over,
people.
yeah.
And that's pretty, you know what I mean? It's scary. We only have so many beds for our community.
And staff to take care of them.
Right,
and-
it is, and specialty staff.
And
That's
yeah,
Lorraine, so you're keeping in your little rural hospital people that should really be in
yeah,
a
they should be.
specific
yeah,
unit monitored by specialists.
Yeah,
It's something
So it is a concern.
Yeah, it is.
Medicine for sure. Like,
that's why we need to really keep protecting our people as much as we can.
not just from COVID.
Right, there's a lot of
Yeah,
other,
there's a lot of-
there's a lot of other
Yeah.
health
Yeah,
conditions
yeah,
that
there
is impacting this all at the same time.
yeah.
So, and hospital wanted me to make sure that it was really clear that this is not just a, you know, we're not overrun by COVID. It's all types of illnesses that we just are not able to
That's
get
why when I
transferred out.
mentioned before, when we lost so many people, it's like all, it's a whole spectrum there.
Mhm.
Yes.
Mhm.
Julie, or doctor, has the hospital mandated vaccinations for their providers in any of the clinics or the hospital yet? Or
Well, Essentia has for the clinic, but the hospital has not, but the Medicare, Medicaid, CMS mandate will affect the hospital in the future, and I don't know exactly the details.
is that coming?
I know that everybody's waiting to see what's really in there, and from what I could tell, it's not gonna be until like the end of October that the information will come out, so.
Because we had a tough time with mandating our clinic.
Mhm.
Some people left,
Mhm.
correct?
Not
They-
very many.
Yeah,
But we had to make it known, we are trying to protect our people.
Mhm.
And some of the tribes mandated all their employees, not just their clinic, all their employees, if they want to work for their tribe, they all had to get vaccinated. Otherwise, they weren't allowed to work there. That's where they took a stand. We're trying to keep working with our people best we can, but when it comes up point, we have to mandate.
So we're just waiting and watching to see what happens with mandates. When it comes to disease control, we're still able to connect with cases at a fairly good rate. So we're feeling pretty good about that. Testing has been a gap in our community, and I will address that because that is going to be getting better just shortly. This is actually the graph on the vaccinated versus the unvaccinated cases for August. So when you look at the number of people who are getting COVID, who are fully vaccinated versus those who are not fully vaccinated, this graph ended up getting much larger over time. So I just had to kind of break it out. So there's a 1.1 to 11.7 differential in deaths. And I think that's something Tweed you asked about. And that's what we're kind of seeing with that. Hospitalizations are definitely less, and numbers of cases are less. So the big thing though with vaccine is the most important thing is it does reduce the hospitalizations and the deaths. And that's the most impactful piece that we can see with the vaccines. You are not invincible just because you've been vaccinated, but you're more likely to not be hospitalized or to die, especially if you're in that high risk category.
And that's true with the booster they're offering now too?
The booster will boost your antibodies and hopefully allow them to kind of eat up that virus when you come in contact with it a little bit better.
And so we're gonna keep educating and keep getting the words out for people so they understand things and don't feel fearful or angry or whatever, that they keep learning about this disease and what we can do. Try to do as best we can. But I want to get back to what you said about the testing.
Okay.
Because I get worried about, I got a lot of grandkids. And some go to public school, some go to tribal school. But I personally get a feeling that they're not testing all the kids for one thing. And they're not contact tracing for another thing. It's like they used to.
They're still doing a really good job with contact tracing.
Well,
our county is, in our school districts are cooperating really well with us.
But I
on
kind of
contact
was
tracing.
worried about that because
It might not continue to be that strong.
Yeah.
But that can be your worry. It's
Yeah.
there, things may change. What I can tell you about testing is we are actually working with Hayward to help them, Hayward School District, to help them get that testing program up and running, and have gotten a message from the state. So we're hoping within the next month we will have testing that is available right through Hayward School. We already have it at Winter School, and LCO does the testing for, or LCO Health Center does the testing for the LCO. We also have finally got our test kits to be a community testing site as well through the health department. And we are going to take advantage of a building recently opening up. So now that Oasis is vacated, it was recommended that that might be a good spot for us to have testing and vaccines. It's much easier than trying to come up to the front of this building. So we will be transitioning over there. Our first testing day will be on Thursday. We will be doing testing by appointments only and vaccines by appointments only at this time. So we're going to get that out into the public. Hoping too that we'll be able to have self-scheduling that will help as well. At this point, we just have PCR sendouts, meaning that we our tests have to go to a lab to get analyzed. So that is going to be about a 2-day turnaround time. If what the lab tells us is the actual turnaround time, we'll find out when we start sending things out. We are trying to get the antigen rapid tests. They used to have those available for community testing sites, but it's hard to get them right now, and they're focusing those on the school programs. So we've been working to try to get some testing supplies, finding out some other ways that we can work with the state on getting some funding so that we don't have to charge for those because it is expensive to go out and buy those tests. We are doing the vaccine appointments on Tuesdays and Fridays. We have boosters for Pfizer, and then we do the Pfizer series and J&J. The other thing that we've been doing this month is, this is flu vaccine month, and we get into the schools to do that. So we're running all over the place to the schools this week and starting a testing clinic. So if you see the nurses in our department, just kind of give them a smile and a pat on the back because they've been running like crazy this week.
Is the flu vaccine compatible with your COVID vaccine?
Yes, you can get them both at the same time. You no longer have to have the wait between any vaccines, actually. So that is helpful. In the beginning, before they had done all of the testing with the other vaccines, we had that separation, and I remember people getting shingle shots and then not being able to get their COVID vaccine, and
Right.
none of that is an issue anymore. So we can get all of that done.
What about the Pneumovax?
Anything. Compatible all the way around.
Really?
Yeah.
Are you
could
seeing
go
more?
into Walgreens, get your Pneumovax and get your COVID booster at the same time.
Are you seeing more side effects with the booster shot, meaning 3 rounds of vaccine?
We
or no?
haven't.
Haven't.
We have not been, well, we, normally people would kind of reach back out and say, oh man, I felt horrible or whatever. And we just have not been hearing any of that. Have you either? Okay. Just have not been hearing any of that. So that's positive
Good.
as well.
Do you know when they're gonna put that out for the younger ones now, that age group?
So this month, the FDA will be looking at Moderna and at J&J for having a booster. And so there will be that's going to actually, I think that's coming next week, right? Or even, yeah, next week. And then the following week is when they're going to be looking at the 5 to 11-year-olds.
Before the end of the month?
For
or at the end of the
Pfizer,
month?
for the end of this month. And that will be a whole new packaging, but I'm thinking they're probably already packaged a lot of supply out because it sounds like it'll go out right away if it is approved. That's it.
What about Moderna?
Moderna, they're going to be looking at that boost. That is next week that they'll be considering that booster. And that will be a half a dose of what the original dose is. Where Pfizer is just a third dose, basically.
Are you done?
I'm done.
Okay.
That was very good.
Yeah, very good.
Yeah,
Very
thank you
good.
for that. Just as an aside, I was in Walgreens this past week and got my flu shot. But there was a gentleman got up to the window and said he wanted his flu shot, shingle shot, pneumonia shot, COVID shot, booster shot.
Oh.
There was another one in there too. No, not gonna happen.
Cushion, yeah. I would recommend not getting all of that at the same time.
Okay. Thank you.
Yeah.
for the
Great,
help.
thank you.
Fiscal, Patty?
You have the budget performance report and the purchase service recaps through August.
Any questions? Okay, and move on to 15.
Anything on the budget?
Yeah, wait. I want to hear about the budget.
That's what you were doing the purchase. I'm sorry.
What,
Go ahead.
I was just asking Tom, did you have anything in there?
Which one are you on?
The fiscal 2022 budget?
Yeah,
status?
I didn't think we were there yet.
Oh, yeah, there we are.
There we are. Okay. So under the 2022 budget, you've got a couple reports. The first one is the Senior Resource Center excuse me, report, or the budget. That includes, the grant funds that are in there as revenue and the expense for that as well. And then some, and the match for that too. The second report is the sheets of paper that you've seen before that Patty presented, the overall Health and Human Services budget with the different departments and functional areas. And if you want to just maybe cover some highlights, Patty, on what we're looking at, it's basically the same programs that you had before, other than the changes that Patty had highlighted previously.
Well, basically, it is the same report that we went over. The only thing that has changed since I
Can you put
submitted the
the front
report.
page of that on the screen? Second budget summary.
So we're on the 22
On the
budget.
22 budget summary, thank you. Nora. So the only thing that has changed is that we did increase by 100, increase Winnebago That is the only thing that was in addition to what I originally had. Another thing too is that when this budget was made and Julie and I planned on budgeting through May of 2022 for COVID. What do you think, Julia?
Yeah, that'll probably be extended.
Probably will be extended, but the COVID, that will not impact the budget because the COVID was budget neutral. So anything that we put to that was covered. So even if, even though you can see that I only budgeted till May of 2022, if it does go on and they will have funding that follows that. But according to this, as you can see, this is pretty much the same report as we had submitted. We did receive an increase in the prep grant by $20,000, which I did also add in when we were increasing the Winnebago. So that was new, that I changed when we increased the Winnebago cost.
I, for one, am glad we're increasing Winnebago every year. I mean, we went from 0 to what, 700,000 last year? 700,000 last year. And adding another 5. I mean, let's at least be realistic. We know that these are going to be continuing expenses. I'm glad we're trying to portray them as something. If we don't spend it, we'll have a party. Okay?
Yeah, I think, budgeting for those expenses realistically is more transparent and showing what the true expenses of the department are. Keep in mind, though, that the funding sources for the total budget, not only comes from the tax levy, but also some fund balance. You recall that we had been under budget for several years and had an increasing fund balance up to over $1 million just in the Health and Human Services Department. And this year we'll be expending or using a lot of that to balance the budget, and then we'll be using some more next year in the 2022 budget. So even though it's budgeted on the expense side, the revenue side contains not only tax levy, but the fund balance usage. So next year in 2022, we'll be using up probably all the remaining fund balance in Health and Human Services, plus some general fund balance. Good news is the general fund balance is healthy. We're at the upper end of our range there. This is certainly not anything that's sustainable in the long term. And as we talked before, the alternatives to this methodology are, cutting $1 million worth of services, either in Health and Human Services or elsewhere in the county, or finding other funding alternatives, which we're trying to seek legislatively. There's, other options, if we get really tight, which, this year we can survive, 21, 22 will be okay, fund balance wise. But, after that, it's, we do need to find a better solution than using fund balance to cover those costs. So, it's the one item that keeps me awake at night in the total county budget. This is, the stickler. We've got certainly problems in other areas too, as we talk about in other committees, but these runaway costs on the mental health side are unsustainable. So questions, comments, directions?
Tom, how far over were we with the out-of-county placement for 21? What do you expect by the end of the year? You said we're going to use fund balance, not all of it, but.
I think, we'll be using all the fund. I think we've got about 315,000 of fund balance in Health and Human Services. So we'll be using that up, and then general fund balance to pick up any other overage. So in the budget, there's about 1.3 million of fund balance usage in the 22 budget.
That is not sustainable.
No.
And you said state help was 2 years away, at least.
At the least, or at the earliest. The other, even if we did try and cut $1 million worth of services, I mean, that's devastating several departments, that's not a solution either. There is an alternative, to issue more debt, which increases taxes. That's an option that could be used. Normally, you can't issue debt for operations, but there is a provision in the statutes for issuing debt for court-ordered
Right.
judgments. So technically, we could cover that instead of using fund balance with debt. So if push comes to shove and you don't want to cut any services, that's an alternative. Again, I mean, there's not a perfect solution that's, obvious, this is the greatest way to go. There's pain and suffering with all the alternatives that we have available to us.
So all of these out-of-county placements at Mendota or Winnebago are court ordered.
Right.
Is that correct?
Yeah.
Other comments, questions? Okay. Now we're going to Youth Justice. Edwards?
Do you have an update on Northwest Turning?
Yeah, so that we were going to go into closed session if that's your prerogative.
Closed session on this?
I have a question, go back up a minute. When you talked about court ordered placement, that's for mental health. Is that also to apply to some of our children that are in placement if they're court ordered?
If they are court ordered, I would say yes. I don't know.
Well, they are. I mean, we have to have an order. in order to
That's
place
right.
them, but-
Yeah.
So it would depend on the diagnosis, whether it's mental health or safety or.
I don't think that would matter because court order would be court ordered. It's however the
Okay.
county wants to interpret what they want to go into debt for.
So that might be a helpful thing there too, for that cost that's going up because of more and more children being placed because of the shortage of staff to be able to get the family functioning better. That's the only way I can say it.
Right.
So the children can come home and be safe. So we have more out-of-home placement with our young people. It's costing a lot, but we don't have enough staff to do all the prep work to make it safe for the children to stay in their homes. So that might be something to look at too, to help with that cost.
Well, and, help is on the way theoretically. I mean, we've got, the ARPA funds available to do certain things that could be applied to mental health or, other things that are related to COVID being the cause. The opioid dollars should start flowing next year in 22. None of that is in the budget because probably, if we get opioid dollars, they would have to be used for, opioid treatment and, those sorts of things. So is that extra thing? So there's nothing in the budget, even though we'll see some money coming in. Can that replace some of the things we're doing now, or is it additional things? Same thing with the ARPA. If we can show that it's COVID related, we could use some of those funds. So we've got a lot of decisions to make on some of those dollars that are coming into the county that will help alleviate that. Again, those are both, short-term things. They're not permanent solutions, but they certainly will help. But if we can get a handle on, some of these issues, alleviate some of the opioid problems that we have and some of the other social problems that we have, then it just trickles down through the Sheriff's Department, Health and Human Services, all facets get touched by these problems that we have.
Okay, for youth justice.
Calvin?
I'm sorry.
Do you want to stay for that?
Oh, I can.
Yeah.
Oh, tell me.
Thank you.
Okay.
I need a
All right,
motion
I'll make a
to-
motion that we go into closed session pursuant to Wisconsin statute S 19.851E for the purposes of deliberating or negotiating the purchasing of public properties and the investing in public funds or conducting other specified public business.
I second.
Edit. Okay, everybody in favor, say aye.
Aye.
Any opposed? Hearing none, motion is passed. We're in closed session. Until, I was just gonna wait until we,
Would you like a roll call vote for that closed session?
Sure.
yeah.
Okay.
Now, any correspondence reports, conferences, discussions?
I want to add that we are planning on building a new elder center. But we're working on the planning now. And a police department. So we're trying to plan for this. Or not a police department, what would we call it? The, safety,
Yeah,
public safety.
public safety. When is the cap?
October 18th,
October 18th?
19th, isn't it, 19th? That's going to be by Zoom. So
We should have a team. Yeah,
we were going to talk to you later about that, which one.
we should, because I didn't realize, Tom, that court ordered things you can borrow money for. That's huge. You said that pretty quietly. How long has that been out there?
Well, it came up a few months ago when we were looking at, issuing debt for the courthouse and looking through the statute on, what you can do on that debt in the process. And so that was like one line in there, and it's like, wait a minute. So we talked about it in our administrators group, the other northern administrators,
Yeah.
when we get together. Nobody has done it yet. Ashland County has been talking to the DOR about it. They're kind of non-committal. I mean, is that the intent of the statute? That's the wording in the statute, that you can do that. Does it apply to these kind of court orders? Well, it says court order. It doesn't say yes, no, or otherwise. So we're thinking it qualifies and is a legitimate use of debt for that purpose because of the same issue. It's like you got these court order things you have no control over that increases your budget. How are you going to pay for it?
And that's way better than cutting services to that amount.
So, I mean, we could do it the same way that we're doing, the borrowing for the capital equipment. Then you issue the debt in December and pay it off in, February, March, or whatever.
And you
So that
spread
you're
it
not
out over
incurring-
everyone.
Yeah, so you're not incurring a
Yeah.
lot of interest, but you're allowed to move it outside the levy limit.
And you include all these second homeowners. Did I say
Yeah,
that?
all
Did I say that?
property
Oh,
taxpayers, all property taxpayers would contribute, yes.
Yes.
Could you stick around for 3 minutes afterwards? I have to run out to the printer and grab the resolution for your signatures.
Further for. Okay, we're adjourned.
Amen.
I'll go grab it.